Hi guys, this is LaToshia Rouse from Birth Sisters Doula Services here in the Triangle area. I am a certified donor doula, and I do birth and I do postpartum. I am a childbirth educator and a breastfeeding educator. And I run across a lot of people who don't quite always know what some of the terms mean and what their service should be like when they are encountering healthcare. And I just love educating on patient and family centered care. That's a field that I've been in for, oh my God, 8 years. And ever since the birth of my triplets, I've been working with clinicians and doctors and nurses on educating on patient and family centered care. I have become a content matter expert on that subject, and it is near and dear to my heart. And a lot of the questions that I get from people who just call me and they don't always know what they're asking. So I'm going to explain to you what you should be looking for when you are selecting your doctor or your midwife as a pregnant person. As you go about this journey and you're navigating healthcare, you want to select a doctor or a midwife that you have taken a look at, that align with your beliefs, that think the way you think about things, and that you can, be sure that they will listen to you. It is very important that those conversations are not one sided and that you're having a conversation that you give information, they give information, and it's an exchange. And it's one that's pleasant. You want to make sure that you're dealing with someone who cares about you and your family and what's best for you. Okay. So you can always ask your doula for help with finding people that might align. Some people have different beliefs about how they want things to go. And so finding someone that aligns is very important. You want to compare people. You want to interview. You want to have a talk. You want to do a tour. You do all of the things that make it so that you can be comfortable with your selection. And you're still evaluating in those initial visits. You're evaluating if that still works for you. Doesn't mean that you can't change doctors, midwives. You can, and you should if you feel the need to. Also, you would need to read your hospital's policies on their patient bill of rights. We always get those, but we don't look at them. And a lot of the details that you need for your interactions are in there. It tells you what you should expect in the care that you receive in that facility. So read it, get familiar with it. And when something falls off and it's not quite in alignment with your patient bill of rights, you have a question, right? And then people have an opportunity to respond. The exchange is still going, okay? So we're weaving together a medical village, and you got to make sure people, they flow with your village, okay? All right. And so then you also need to learn about shared decision making. It's a very important thing. Doctors are still being taught about this. I teach a lot of people about how to handle that interaction of trying to make a shared decision with healthcare professionals when they're not quite, going through the steps and not quite following along a bit because they're still learning some of them. And that's fine. We want them to learn. So, in the instance that you do meet up with someone who's still working through that, you can help guide the conversation and give them information that they need about you. And you can help by asking the right questions and getting the information. So, shared decision making is very important. Um, and like I said before, if you need to switch, um, yeah, do it. Absolutely do it. It's a part of, a part of your journey and making sure that everything is in alignment with you and that you have the care team that you want and you deserve. It's not being picky, it is you making sure that you're a good consumer of healthcare and that you're paying for services in a place through insurance or out of pocket or however, in a place that is absolutely worthy of you coming there. So if you need to do that, Another thing I would always advise is to take a childbirth education class, because the more information you have, the better equipped you are to have conversations with healthcare professionals. You have to know some things to have these conversations and for there to be a good exchange of information. You have to have information and you have to also give them information, right? So take a childbirth education class. Know what questions you should be asking, and make sure that you're able to get the information you need. It helps so much. Um, you can always check in and see. Um, with me, I have childbirth education class, and there are others around if you're interested. And find a childbirth education class and take it. You will not regret it. I've had people in my class who have had children before, and they come and take a class and go, I never knew that. I never knew that. That's new information on several occasions. There's a lot of information that people just don't know. So I want you to know. I want you to be able to engage healthcare in a meaningful way, and I want you to experience patient and family-centered care at its optimal level. You deserve it. All right. Have a wonderful day. And this is LaToshia Rouse from Birth Sisters Doula. And I'm so glad to meet you. Have a good one. Bye.